More than 88 million prescriptions for this pill are written in the United States every year. It is one of the most effective blood pressure medications ever developed, and it quietly depletes a mineral that your immune system, your wound healing, and your sense of taste all depend on.
This is for the
Almost nobody
antibiotics.
taking it
Take
has been
one
told to
tablet every
check.
12 hours until
High
you're
blood
sick.
pressure is called the silent killer for a reason. It produces no pain, no obvious warning sign, no moment where the body says something is wrong. It simply builds pressure inside the arteries, year after year, until something gives way. A heart attack, a stroke, kidney failure. For more than 88 million Americans, the prescription that stands between them and that outcome is one small pill taken every morning, lisinopril. It belongs to a class of medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. The name is technical. The way it works is not complicated. Your body produces a hormone that tells blood vessels to tighten. Tighter vessels mean higher pressure. Lisinopril blocks the enzyme that makes
The
that
vessel
hormone.
wall slowly
Less hormone.
relaxes and
Vessels
opens.
relax, pressure comes down. It is effective. It is well studied. It has been protecting hearts and kidneys for decades. But like every medication that works through a specific biological pathway, it also affects things that share that pathway. And one of those things is a mineral that most people never think about until they start running low on it. That mineral is
The zinc
zinc.
molecule
Zinc is
moves
not a
slowly
headline
through the
nutrient.
bloodstream.
It does not get the
The
attention
camera
that calcium or
follows.
vitamin D get. But inside the body,
The zinc glow
it is
pulses
essential in
softly
ways that
throughout
touch
the body.
almost every system. Your immune system uses zinc to produce and activate the white blood cells that fight infection. Without enough zinc, the immune response becomes slower and less effective. Infections that a healthy immune system would handle in a few days take longer to clear. The body is more susceptible to what it encounters and less capable of responding quickly when it does. Your skin uses zinc as a critical part of the healing process. Cuts and wounds that should close in days take noticeably longer. Skin that was
Based on the
resilient
chart,
begins to feel
I
fragile.
recommend we adjust
Your
your
body
dose.
uses zinc to produce and regulate dozens of hormones, including testosterone, which affects energy, muscle strength, and mood in both men and women. Your sense of taste and smell depend on zinc in ways that most people do not realize until those senses begin to change. When zinc levels drop gradually, food begins to taste different, blunted, less distinct, flat. It is a change so subtle and so slow that almost everyone who experiences it attributes it to getting older, not to a blood pressure pill they have been taking for 5 years. And your brain uses zinc to regulate mood, cognitive function, and emotional stability. Research exploring the connection between zinc deficiency and depression has found consistent associations, particularly in older adults. Research has found that ACE inhibitors, the class of medications that lisinopril belongs to, may deplete zinc levels in the body over time. The mechanism is straightforward. Lisinopril is processed and excreted primarily through the kidneys, and zinc is also excreted through the kidneys. Research suggests that long-term ACE inhibitor use may increase the amount of zinc lost through urine, meaning the body sheds more zinc daily than it normally would without the medication. Over months, over years, the losses accumulate, and the symptoms of slow zinc depletion are among the easiest to miss because they look like aging, like stress, like a dozen other ordinary explanations that nobody connects to a blood pressure medication taken every morning. If someone you know has been on this medication for years and has noticed that their immune system feels weaker than it used to, that food does not taste quite right, that wounds seem to take longer to heal than they should, stay with this. Beyond zinc, the lisinopril label warns about something that requires more immediate attention: potassium levels. Lisinopril affects how the kidneys handle potassium. Normally, the kidneys filter excess potassium out of the blood and excrete it through urine. ACE inhibitors reduce the hormone that tells the kidneys to excrete potassium. The result, potassium can build up in the blood over time. High potassium, called hyperkalemia, is dangerous. The heart's electrical system depends on potassium being in a very precise range. Too much potassium, and the electrical signals that regulate the heartbeat become unstable. Heart rhythm problems, muscle weakness, in severe cases, cardiac arrest. The FDA label for lisinopril warns directly about hyperkalemia. It recommends monitoring potassium levels, especially in patients with kidney problems, diabetes, or those taking other medications that also raise potassium. And yet, in clinical practice, many long-term lisinopril users go extended periods without having their potassium levels checked. High potassium produces no obvious symptoms in most people. It builds silently until it does not. The label also warns about kidney function itself. This creates a situation that is worth understanding carefully. Lisinopril is frequently prescribed specifically to protect the kidneys, particularly in people with diabetes, where high blood sugar damages kidney blood vessels over time. And lisinopril does protect the kidneys when the dose is right and the kidneys are being monitored. But in patients who already have reduced kidney function or who develop kidney problems while on the medication, lisinopril can put additional strain on the kidneys rather than protecting them. The label warns that in patients with impaired kidney function, lisinopril levels can build up in the body because the kidneys are responsible for clearing the drug. And when they cannot clear it efficiently, more drug accumulates with each dose. More drug, more potassium retained, more pressure on already compromised kidneys. This is why the label explicitly recommends monitoring renal function periodically in patients on long-term lisinopril therapy. Monitoring that in practice does not always happen as consistently as it should. There is also a side effect that almost nobody warns patients about before they fill their first prescription: a dry, persistent cough. It affects up to 20% of women and 10% of men who take ACE inhibitors long-term. Not a cough from a cold, not a cough from allergies, not a cough that goes away with time or treatment. A chronic, dry, nagging cough that comes directly from the mechanism of how the drug works in the body. When lisinopril blocks the enzyme that produces the blood pressure hormone, it also prevents that same enzyme from breaking down another substance in the body called bradykinin. Bradykinin builds up in the lungs and airways, and accumulated bradykinin irritates the airways, producing a cough that does not respond to cough medicine, antihistamines, or any other standard treatment. Because the cause is not an infection or an allergy, the cause is the pill. Many people spend months, sometimes over a year, visiting doctors for this cough. They try allergy medications, they change their diet, they get tested for asthma. No one connects it to the lisinopril until finally, someone does. When the medication is switched to a different class of blood pressure drug, one that does not share the same mechanism, the cough resolves, often within weeks, after months of being unexplained. None of this means lisinopril is the wrong medication. For millions of people with high blood pressure, it is one of the best options available. What it means is that long-term use requires active monitoring of zinc, of potassium, of kidney function. That is not always happening. For zinc, foods rich in zinc include oysters, red meat, pumpkin seeds, chickpeas, and cashews. Many doctors and pharmacists commonly discuss zinc supplementation for long-term ACE inhibitor users, though supplementation should always be discussed with a doctor first, since zinc interacts with other nutrients including copper. For potassium monitoring, research supports regular blood panel testing at least annually for anyone on long-term lisinopril therapy. For kidney function, many doctors recommend a kidney function test called a creatinine and eGFR panel periodically throughout long-term treatment. And the questions worth bringing to the next appointment: when were my potassium and kidney function last tested? Has my zinc level ever been checked? And do I have any symptoms that could be related to low zinc? Do I have a cough that started around the time I began this medication? Is the dose I am on still appropriate given my current kidney function? These are the questions of someone who understands that a medication taken every day for years deserves ongoing attention, not just a refill at the pharmacy counter. When was the last time your doctor checked your potassium on this medication? Subscribe to Med Truths and keep asking. Here is the truth about lisinopril. It is one of the most effective and widely used blood pressure medications in the world. It protects hearts. It protects kidneys when monitored correctly. But it works by blocking a pathway that also affects how zinc moves through the body, And it affects how potassium is retained silently until the levels become a problem. And it can strain the same kidneys it is prescribed to protect when those kidneys are not being watched closely enough. That is not hidden. It is in the label. It is in the monitoring recommendations. It has always been there. You just needed someone to read it out loud.